Good afternoon. We're on the record. This public hearing before the Health Systems Planning Unit, identified by docket number 18-32271, CON, is being held on April 30th of 2019 to consider the transfer of ownership of St. Vincent's Medical Center to SVMC Holdings Incorporated, an affiliate of Hartford HealthCare Corporation. I take judicial notice of docket number 18-32272 involving Hartford HealthCare's application for the transfer of ownership of St. Vincent's Multi-Specialty Group Incorporated to SVMC Holdings Incorporated. This public hearing is being held pursuant to Connecticut General Statutes 19A, 639A, and will be conducted as a contested case in accordance with the provisions of Chapter 54 of the Connecticut General Statutes. My name is Michaela Mitchell. I have been designated by Executive Director Victoria Veltri, Executive Director of the Office of Health Strategy, to serve as the hearing officer for this matter. My colleagues, Brian Carney and Jessica Rival, are also here to help assist me in gathering facts related to this application. Additional staff present from the Office of Health Strategy include Leslie Greer and Juliet Manilin. If you look to my left, Juliet has her hand raised. The Certificate of Need process is a regulatory process, and as such, the highest level of respect will be accorded to the parties, members of the public, and to our staff. Our priority is the integrity and transparency of this process, and accordingly, decorum must be maintained by all present during these proceedings. Should any member of the public have questions or need assistance, please let Leslie or Juliet know by raising your hand, and they will come to assist you. Also, I'd just like to remind everyone in attendance to silence or turn off their mobile devices. This hearing is being recorded and will be transcribed by post-reporting services. All documents related to this hearing that have been or will be submitted to the Office of Health Strategy will be available for review through our CON portal. Instructions to access the portal are on the information sheet, which you probably received when you came in from Ms. Greer. In making its decision, we will consider and make written findings concerning the principles and guidelines set forth in Section 19A, 639 of the Connecticut General Statutes. St. Vincent's Medical Center, SVMC Holdings Incorporated, and Hartford HealthCare Corporation have been designated as parties in this proceeding. At this time, I'm going to ask Mr. Carney to read into the record those documents already appearing in HSP's, or the Health System Planning Unit's, table of record.
Good afternoon. At this time, I'd like to add to the record Exhibits A through Exhibits H. In addition, we have a couple of items. Exhibit I, which is the agenda, and Exhibit J, which is the table of record that were just omitted.
And I'll have counsel for the applicant. If you could just state your name for the record and whether or not you have any objection to the items on the table of record.
Yes, Jennifer Fusco, counsel for the applicants. We have no objections to the table of the record. Thank you.
Okay. So the applicants will present their direct testimony. The Health Systems Planning Unit will ask questions of the applicant, and then we will hear from the public. I will reserve the right to allow public officials and members of the public to testify outside of the order of the agenda if the hearing begins to run long, and I'll also try to accommodate the applicant, who also gave us a list of people that needed to go in a certain order. I'd like to advise the applicants that we may ask questions related to your application that were already included or you may feel have already been addressed. And I want to reassure you that we've looked at the application carefully. We may just ask those questions just as a point of clarification or to get them on the hearing record. So this time I'm going to ask all of the individuals who are going to testify on behalf of the applicant to stand and raise their right hand, and the court reporter will swear you in.
Please raise your right hand. Do you swear to tell the truth, nothing but the truth, so help you God?
I do.
Thank you.
Thank you. When you testify, just make sure that you state your full name and adopt any written testimony that you have submitted on the record prior to testifying today. The applicants may now proceed with their testimony. Before beginning, I just ask the witnesses to define any acronyms that you may use by just stating what it is so that we're all aware and for the clarity of the record. All set.
Fair enough. Ready to go? Okay.
Ready to go.
All right. Good afternoon. My name is Elliot Joseph. I'm the Chief Executive Officer of Hartford HealthCare. I'd like to take a few minutes this afternoon to talk about the importance of this transaction to the people of Fairfield County and to us at Hartford HealthCare. Hartford HealthCare is transforming healthcare. We're addressing the core problems of the American healthcare system by coordinating care across the full continuum of care, offering hundreds of access sites from our current 270 physical locations to our digital front door, which includes telehealth and online patient portal. We are committed to value in healthcare. We have a solid track record of moving patients to the lowest cost appropriate care setting. As a system, currently 52% of our net revenue comes from outpatient care, 48% from inpatient care. As examples, many patients who might otherwise have gone previously to our hospital emergency departments are now using our widely dispersed network of convenient urgent care centers. Outpatient diagnostic centers now are offering an alternative to more expensive inpatient radiology, and patients can choose to have a range of procedures at one of our community-based ambulatory surgery centers instead of having that surgery at the hospital. It is our vision to be most trusted for personalized coordinated care, and we take care coordination very seriously. Integrated Care Partners, our clinical integration organization, has positioned 28 community care managers and 2 skilled nursing facility coordinators in 66 primary care offices. Last year, these coordinators provided more than 14,000 care transition outreaches. Those cracks that patients historically fall through, we're working hard to eliminate them. In addition, we have 11 full-time behavioral health clinicians supporting 16 primary care practices. These providers had nearly 11,000 behavioral health visits in this fiscal year 18. The integration of primary and behavioral care has led to a significant decrease in anxiety screening scores, EDUs, all-cause readmissions, and improvement in depression screening scores. We are currently expanding this program for further outreach. I've spoken of the problems, but I want to say that this is actually an exciting time in healthcare, an industry that represents nearly 1/5 of the gross national product of our country is being revolutionized by visionary entrepreneurs, especially in the realm of digital health. The innovators come from tiny startups and tech giants like Google and Apple. At Hartford HealthCare, we believe we're building an organization that will be seen as what we call a plug-and-play environment, where innovators can tap into our care ecosystem to develop and improve the next wave of new healthcare products and services, new ways to heal, new ways to keep us healthy, and make care more accessible and affordable. This futuristic vision of healthcare doesn't leave hospitals behind. Far from it. Hospitals provide essential services to our community and our state and contribute to the quality of life that Connecticut citizens enjoy. Hospital centers stand ready to save lives threatened by accidents and violence. They provide the most advanced care for complex medical problems, and when disasters strike, whether it's an epidemic or a hurricane, hospitals are there to protect their communities and to serve 24/7. Our hospital infrastructure has to be kept strong. Hospitals have to be part of this overarching industry transformation. Fairfield County needs a strong St. Vincent's Medical Center. Hartford HealthCare has created a highly integrated system of care, and we intend to bring that model to southwestern Connecticut. In our model, the hospital is the centerpiece of a fully connected system of care. With St. Vincent's as part of healthcare, we will be providing far more than patient choice. We will be providing broader access, higher value, and excellent care coordination. Thank you.
Attorney Fusco, I just wanted to ask, would you like us to go ahead and ask questions of,
If you'd like to, so Mr. Joseph needs to leave at 3, so if it works for you to ask those questions now, it probably works best for us.
all right, so why don't we go a little bit out of order and we'll go ahead and do that.
Okay, Mr. Joseph. Hartford HealthCare's acquisition of St. Vincent's Medical Center would bring the total number of hospitals under its control to 7. The applications submitted to OHS in general usually support these acquisitions by saying they create multiple efficiencies and cost savings for the system. As a leader of a large healthcare system, I'm sure you've given this some thought. The question is there a point where a system becomes too large?
So that's the opposite end of the question. You know, how big does the health system have to be successful? I get asked both those questions fairly routinely. I don't know that there's a good, I don't know that I'm able to answer that question. I don't know. The work that gets done to ensure that there's substitutions, viable substitutions or alternative care is an important consideration. But at the same time, as I spoke in my prepared remarks, the fuel necessary to rebuild the American healthcare delivery system, whether it be from the digital transformation, the electronic health records, predictive analytics, making the investments in the required technologies and program development require scale. And that's what's causing the American healthcare system to go through this period of consolidation, as opposed to being what I finally refer to as America's largest cottage industry. We're revolutionizing the industry.
So would there be a point where you add a hospital and you start to see diminishing returns from, they say, these efficiencies or cost savings that you would be aware of? And what would the correct number, if you could choose, be for a hospital system in Connecticut? Or is there no right number?
I don't think there is. I don't think there's an easy answer to any of these important questions you're asking. I think it's a market by market consideration. You know, we've expanded our services in certain markets without a hospital, and we've expanded services in markets where we operate a hospital. It's about building out the full system of care. We actually don't think about it as hospital centricity. We think about creating a different kind of delivery system that requires some hospitals in it. So it's the idea of how many is elusive, and I think it's situation specific.
Does Hartford HealthCare plan to acquire any additional systems within, say, the next 5 years in Connecticut, beyond St. Vincent's, if that's approved?
At this point, there aren't any plans to do that. I'd say that we continue to look at all the alternatives, and the world that we're working in and living in, as you all know, is changing dramatically every day. So it's hard to predict. We don't even do a 5-year plan anymore because the changes are happening so quickly.
Any plans to go out of state to acquire systems there?
No plans at this point. Same point of view. You know, as I'm sure you have, you look around the country, there are a lot of systems that have been built that stay within the boundaries of their states, but increasingly, as the need for even greater scale and greater capital investment arrive, people are looking for new alternatives and new kinds of relationships. So it's a TBD. We're not quite sure. TBD, to be determined. To be determined. I want to make sure I get all the follow the instructions.
I know that one.
All right. Okay.
Just 2 more questions. So, in the course of business and our office, we receive a lot of, we read a lot of articles, and we look at a lot of studies that say that these consolidations actually increase prices for patients. Can you talk about that a little bit? And I just want to let you know that I'm cognizant of what you talked about in terms of looks like making care more accessible and affordable. So if you could expand on that.
Yeah, be happy to. We're very proud of the fact that because we've built the kind of scale that we can make the kind of investments that are required, we're able to really create a system that works with patients and communities to move people to less affordable sites of care. As a standalone individual hospital, we would not be able to do that anywhere near the degree that we're capable of doing it today. So the multiple ambulatory surgery centers, the multiple urgent care centers, the multiple outpatient diagnostic centers are all moving patients to care closer to their homes typically and less expensive. And probably equally important, those centers are tied together through our electronic health record and all of our providers. So it is a comprehensive, coordinated, integrated experience across the continuum. We're very proud of that. So we think there's an opportunity. We believe we're demonstrating more affordability and better access at the same time.
And then the last question that we have for you relates to our criteria. So, as you know, we have to look at 12 factors in determining whether or not to go ahead and grant a certificate of need application. And one of the things that we were kind of concerned about or wanted to take a closer look at was clear public need. And if you can you elaborate on how this transaction satisfies that criteria?
So I probably will leave the details of the answer to that question to some of my colleagues who are more versed in the actual data around need, which is what I expect you're looking for. So I'm not going to venture into that territory, but feel free to ask some of the other folks in this room who that's their job, to be able to communicate what the data says. But I'll just say generally, for what it's worth, be assured we wouldn't be entering into a market and doing this kind of work if we didn't feel there was an incredibly important need being fulfilled by St. Vincent Medical Center, and the idea that we were going to export the system of care delivery system that we've created into Fairfield County. We think there's a remarkable need for that.
Thank you so much for your time.
My pleasure.
We don't have any additional questions. I am going to go ahead and turn back to you, Attorney Fusco, if you have anything else that you wanted to ask of your home client, or if there's anything else.
Comfortable?
Yeah, good.
Yep, I
Okay.
think we're
If you'd
okay.
like to
Thank
go
you so
back
much.
to your direct testimony.
Appreciate that.
Yeah,
Thank you.
appreciate the opportunity, and thank you for understanding my schedule. I appreciate that.
Absolutely.
Oh, yeah, I do. I think he misspoke at one point. I think you said less affordable sites of care, and he meant more affordable, less costly. So
Thank you, yes.
take a note of that. More affordable, less costly. So I think you guys understood what he was saying, but just
Thank
for
you.
clarity of the record.
Thank you.
So we'll move on with our pre-filed presentation
Yes.
now. Okay. This is John Rudolph, the CEO of St. Vincent's. I'll let you go ahead.
Okay, thank you. Good afternoon, Attorney Mitchell and members of the OHS staff. My name is Dawn Rudolph, and I serve as President and CEO of St. Vincent's Medical Center. I adopt my pre-filed testimony. I'm here on behalf of the St. Vincent's leadership team to tell you about our organization, its mission, vision, and values, why we find ourselves seeking to partner with a regional health system, and the opportunities that we know will result from Hartford HealthCare's acquisition of St. V's, including the ability to expand our service network, enhance the quality of care that we currently provide, and advance our population health initiatives. St. Vincent's is part of Ascension, one of the nation's leading nonprofit Catholic healthcare systems. Ascension operates multiple acute care hospitals in several states throughout the country. St. Vincent's is its only hospital in Connecticut. St. Vincent's mission is to care for all patients, with particular reverence to those who are struggling and poor and vulnerable, the most vulnerable members of our community. Our hospital generates approximately 15,000 inpatient discharges annually and has a payer mix that is heavily weighted towards governmental payers, with Medicare and Medicaid accounting for approximately 70% of our discharges. St. Vincent's is a 473-bed teaching hospital and a level 2 trauma center. We have regional centers of excellence in cardiology, oncology, and stroke. We operate a behavioral health network that includes a 76-bed facility, inpatient facility in Westport, We also operate outpatient care centers, providing a continuum of services for children, adolescents, and adults with special needs. We operate a 250 provider multi-specialty group with locations throughout Fairfield County, which you will hear more about later today. St. Vincent's is part of the Health Improvement Alliance, a multi-stakeholder coalition working to improve the health and well-being of the greater Bridgeport community. It was through the Health Improvement Alliance that we conducted our 2016 Community Health Needs Assessment and the Community Health Improvement Plan. This Community Health Needs Assessment identified as recurring health issues in our community: chronic disease, mental health and addiction, access to and affordable healthcare services, aging issues, violence, and safety. A lack of affordable medical insurance options were also noted as a significant barrier to access. We are working towards addressing these needs through the Community Health Improvement Plan and at the same time working with the Health Improvement Alliance on an updated Community Health Needs Assessment for 2019. Although St. Vincent's is part of a large health system that provides it with certain resources and scale, we have found it difficult as a standalone hospital in Connecticut to develop and support the network of comprehensive care that our community deserves, and also to find progression on our population health initiatives. In recent years, St. Vincent's has suffered the loss of a substantial number of primary care and specialty physicians due to retirements and also practice realignments. This has resulted in a decrease in inpatient discharges for us and a decline in the medical center's overall financial performance. We have made significant investments in growing primary care, expanding our ambulatory network, and establishing partnerships in an effort to mitigate the impact of these losses. But despite our best efforts, we have struggled to rebuild our network and keep pace with the inpatient losses, and this situation is not expected to improve materially unless we move forward with a proposed partnership with Hartford HealthCare. The decision to seek a partner for St. Vincent's was driven by our understanding that in order to achieve long-term sustainable success, we need to be able to do things like expand our primary care network and our physician base, to grow our ambulatory footprint and navigate the transition to a value-based care model. We humbly determined that this was the best done in collaboration with a regional health system that could help St. Vincent's build the clinically integrated, locally focused network of care that is needed to achieve our goals and our objectives. After a broad and thorough RFP process and extensive due diligence, Hartford HealthCare was selected as our partner. Some of the many reasons why Hartford HealthCare was chosen over other candidates include their reputation in the provider community and ability to assist us with the growth in the ambulatory footprint. It will enhance our ability to attract and retain top talent, not just physicians, but clinical providers and our associates that have supported us through the years in the provision of care. Hartford HealthCare has quality analytic tools and quality improvement initiatives that will benefit St. Vincent's, and the success of their institute model and the benefits of extending that model to Fairfield County will be seen as an enhancement. Their proposed capital commitment, which will include investment in the upgrade of our organization's electronic health record to Epic, is also noted to be an improvement. You will hear comments today from our associates, employed and aligned physicians, elected officials, and members of our community. Everyone is excited about the prospect of delivering on this multi-year strategic initiative by partnering with Hartford HealthCare. Together, we look forward to further developing services at St. V's and improving the quality of care we provide while enhancing the overall health and well-being of the community that we serve. We at St. Vincent's look forward to your approval of this transaction, and thank you.
Thank you.
Good afternoon, Attorney Mitchell and members of the Office of Healthcare Access staff. My name is Jeff Flax. I'm the President and Chief Operating Officer of Hartford HealthCare. I adopt my pre-filed testimony. Thank you for this opportunity to speak with you about the proposed acquisition of St. Vincent's Medical Center, a transaction that, as you heard from Mr. Joseph, presents an opportunity for Hartford HealthCare to extend its vision of providing patients with high-quality healthcare choices to Fairfield County. My remarks today will focus on the benefits of the proposed acquisition for both organizations, as well as Hartford HealthCare's experience successfully integrating hospitals into our system of care. As you heard from both Mr. Joseph and Ms. Rudolph, St. Vincent's and Hartford HealthCare share a common mission, vision, and values. Both organizations seek to be a trusted care provider and offer patients a personalized, coordinated care experience focused on clinical excellence. We are each committed to advancing population health initiatives and improving the health and well-being of the communities that we serve. Hartford HealthCare operates under a model of leadership that facilitates the integration of our facilities and services to increase efficiency, quality, and patient satisfaction. St. Vincent's will be assimilated into the Hartford HealthCare culture and operational model and aligned further with our patient-focused mission, vision, and values. One of the many benefits that Hartford HealthCare can offer St. Vincent's is a significant investment in the care, coordination, innovative care delivery systems, translational research, new technologies, and analytical capabilities that are needed to transition from a fee-for-service environment to one that is based on quality, outcomes, and population health management. Hartford HealthCare is actively pursuing population health management and value-based reimbursement initiatives, which will extend to Fairfield County. Examples include expansion of our care coordination capabilities to include integrated care providers, participation in the Medicare Shared Savings Program, and development of the data and analytics necessary to support value-driven payment models. Our proven ability to recruit and retain physicians and allied health providers will also be key to sustaining and improving care in the St. Vincent service area. Hartford HealthCare offers providers the ability to coordinate with and rely upon an integrated network of primary and specialty providers that are aligned with a clinically integrated health system. We will also extend our highly successful Institute model to Fairfield County, which will enhance care coordination and access to clinical subspecialties and be attractive to medical talent. One of our first investments will be the conversion of St. Vincent's and its ambulatory sites to the EPIC system to allow for better care coordination, reporting, and tracking of clinical outcomes. The St. Vincent's providers will also have access to Hartford HealthCare's clinical councils and our quality improvement platform to evaluate care and clinical outcomes, support change where necessary, and achieve a single standard of excellence that has evidence-based care across the system. As Mr. Joseph mentioned, Hartford HealthCare has grown significantly in the last decade. We have a track record for successfully integrating hospitals into our system of care, and we have developed best practice integration strategy to guide our efforts. Our prior hospital affiliations have resulted in operating efficiencies and cost savings, clinical collaboration, development of community care networks, physician recruitment, and investments in technology, equipment, and infrastructure upgrades. For example, Charlotte Hungerford became part of our Hartford HealthCare system on January 1st, 2018. In just 15 months, the following service enhancements have been implemented. Recruitment of 8 primary care and 14 specialty care providers. Employment of 9 hospitalists that have enhanced the service to provide call coverage for all specialists. Enhancement of gastroenterology services. Acquisition of an endoscopy center of Northwestern Connecticut, which was approved by the Office of Healthcare Access on August 30th, 2018. The expansion of urgent care services in Torrington with our urgent care partner, Go Health. That partnership went effective January 2019. The enhancement of inpatient behavioral health services, and we established the Center for Healthy Aging. We are confident that we are the right partner for St. Vincent's and that we will be successful in integrating the hospital and its affiliates into our system of care and enhancing access to much-needed services for the benefit of the greater Bridgeport community. I thank you for your time, and I am available to answer any questions.
Thank you.
Good afternoon, Attorney Mitchell and members of the OHS staff. My name is Mike Daglio. I'm the Senior Vice President of Hartford HealthCare and President of the St. Vincent's Medical Center Holding Incorporated, which will be the entity that will acquire St. Vincent's as part of the proposal before you today. I will also become President of the Fairfield region for Hartford Hospital, Hartford HealthCare, which will be formed once St. Vincent's is acquired, and I hereby adopt my pre-filed testimony. As others have said, the focus of this transaction is on integrating St. Vincent's into a well-established Connecticut-based health network that will allow the hospital to expand access to primary and specialty care services, build a comprehensive ambulatory care network, enhance the quality of care, and better manage population health, just to name a few of the benefits. I'm here today to talk about our preliminary plans for service enhancement in Fairfield County and the processes that Hartford HealthCare will undertake to determine capital and programmatic investments in the region. I will also discuss how the hospital's community health needs assessment will inform strategic planning and how the system's governance structure ensures local input to these processes. From both a leadership and governance perspective, there will be sufficient continuity and community representation to ensure that the health needs of the greater Bridgeport community are adequately identified and addressed. St. Vincent's will be the cornerstone of the new Fairfield region of Hartford HealthCare. The region's board of directors will include a diverse group of individuals reflective of the community, including clinicians, local business leaders, and representatives of community-based organizations. I personally met with each of these individuals we are considering for the board, and I am impressed with their passion for this hospital and the community and the knowledge and skills that they have to offer all of us. One of the most important things that the Fairfield Regional Board will do is oversee the community health needs assessment and the community health improvement plans and the processes, and advocate for the region's health needs. Members of the Fairfield Regional Board will also serve on the Hartford HealthCare Board and Board of Directors and the board's Quality and Safety and Finance committees of the board. This ensures sufficient local input into the strategic planning process for St. Vincent's at the system level. Once this transaction closes, we will immediately begin preparing a strategic plan and a medical staff development plan and a provider needs assessment for the Fairfield County region. Strategic investments in medical staff development will be identified and prioritized in alignment with the hospital's most recent and upcoming CHNA, Community Health Needs Assessment. While we cannot engage in joint planning at this time with St. Vincent's in advance of the closing, we have a preliminary sense of where our initial investments in programs and services might be made. These include, but certainly will not be limited to, the investments in the following: ambulatory network development with a particular focus on primary care, services directed at an aging population including primary and specialty care, psychiatric care, home care, skilled nursing, and rehabilitative services. Inpatient and outpatient behavioral health services, as has already been mentioned, and additional post-acute care services that are required to adequately manage population health services. The Community Health Needs Assessment process for the Fairfield region will inform our strategic planning to ensure that the health needs of the community are being met. As Ms. Rudolph mentioned, St. Vincent's is part of the Health Improvement Alliance, a multi-stakeholder coalition working together to improve the health and well-being of the greater Bridgeport community. The Alliance is in the process of preparing an updated Community Health Needs Assessment for the service area to be published in 2019. Hartford HealthCare intends to provide system support to St. Vincent's to assist the hospital in addressing health needs identified in the Alliance's 2016 and 2019 Community Health Needs Assessments. Hartford HealthCare is next due to complete CHNAs for the regions in 2021. At this time, the Fairfield region will be brought into the system CHNA process, which includes collaboration with community organizations. Hartford HealthCare will continue to support St. Vincent's leadership role in the Health Improvement Alliance as we move forward together addressing the health needs of the greater Bridgeport community. And in fact, we actually are looking at the St. Vincent's model and the Greater Bridgeport Communities model as a standard of care for us going forward, and we intend to adopt the model that St. Vincent's has created with their collaborating partners in the Greater Bridgeport area, and making that a standard of care and just standard of way we approach all of our community health needs assessments across all of our regions. We think it's a best practice model, and we intend to adopt that immediately for the next process. Like my colleagues, I'm excited for this transaction and the possibilities it presents to improve access to and the quality of healthcare for residents of Greater Bridgeport and Fairfield County. Thank you for your time, and I'm available to answer any questions. So thank you.
Thank you.
Dr. Orlando's just got it.
Good afternoon, Attorney Mitchell, members of the OHS staff. My name is Dr. Rocco Orlando, and I'm the Senior Vice President and Chief Medical Officer for Hartford HealthCare. I adopt my pre-file testimony. I'm going to keep my remarks brief, as you've heard from my colleagues about the quality enhancements and clinical service delivery improvements that will result from the acquisition of St. Vincent's and the integration of the hospital and its affiliates into the Hartford HealthCare system of care. The enhancements that we'd anticipate include the planned conversion of St. Vincent's and its physicians to our EPIC electronic health record system. This improves access, promotes care coordination, standardization, and sharing of best practices, as well as enhancing patient engagement through the patient portal. As Mr. Flax mentioned, we would also extend our institute model to Fairfield County to enhance the delivery of care in key service lines, and to really increase the availability of specialty care that's available using that model. St. Vincent's would also be included in our clinical council quality improvement initiatives, and that's something that we're particularly proud of, where we have clinical councils, over 40 of them, that work across the system, bringing together multidisciplinary groups of clinicians supported by quality staff, by supply chain, by informatics, by information technology, all oriented to improve the quality of care and decrease the cost of care by eliminating unneeded clinical variation. And then finally, we would anticipate an increased focus on patient experience and satisfaction. That has been one of our major drives and initiatives to really put the patient at the center of what we do and to enhance that experience. And those capabilities would also now be available at St. Vincent's. I look forward to your approval of this transaction so that we can bring St. Vincent's the single high standard of clinical excellence that has been the hallmark of Hartford HealthCare and its providers. And I'm available to answer any questions that you may have about clinical services and quality initiatives at Hartford HealthCare, and I thank you for your time.
Thank you.
That concludes our presentation on the hospital CON.
Thank you. Let me just, give me one moment. All right, Attorney Fusco, do you mind if we take 3 speakers? I noted that there was somebody that needed to leave at 3, and there was a couple other people that needed to leave early.
Yep, that's fine. It's up to you how you'd like to order questions, and public, we're comfortable any way you'd like to do it.
All right, let me just go off the record for just 1 minute. I just want to confer with my staff and see what we have here. So just for the public portion, I just want to make a brief announcement that each person who wishes to speak, just make sure that you've signed in with Ms. Greer, who's standing adjacent to the podium. And we're going to call people in the order in which they've signed up, unless you've made prior arrangements with us because you have to leave early. Speaking time for general public is limited to 3 minutes. Don't be dismayed if we stop you. Just know that we want to give everybody the opportunity to speak, but we also want to be fair. And then additionally, if there's anything that you feel, if we do have to interrupt you, if there's anything that you feel that you want to submit to us in writing, you can do that. We're going to keep the record open to receive additional comments to the Office of Health Strategy up until May 7th. At this time, I'm just going to go ahead and turn it over to Ms. Greer, who's going to call our speakers up in the order in which is appropriate.
Okay, when I call your name, if you come and have a seat in one of the reserved seating, and you'll speak in the order in which I call your name. Bertina Baptista, David Ingmanson, and Tiffany Rodriguez.
Good afternoon. My name is Albertina Baptista. I'm the Deputy Director of Health and Social Services for the City of Bridgeport. Good afternoon, Attorney Mitchell and members of the Office of HealthCare staff. Mayor Ganem, who could not be here today, has asked me to come before you to voice his support for the transfer of ownership of St. Vincent's to Hartford HealthCare. St. Vincent serves as an anchor healthcare institution and is one of the largest employers in the City of Bridgeport. Since 1903, it has served patients with compassion and quality and provided our community with a source of pride, given its outstanding reputation and wonderfully dedicated employees. We also provide 25% of St. Vincent's employees. We are also proud that 25% of our St. Vincent's employees also call Bridgeport home. The acquisition of St. Vincent's makes sense for our community and for the employees at St. Vincent's. It helps to continue a tradition of excellence in healthcare that residents have come to depend upon, and ensures that the greater Bridgeport community has vital healthcare organizations and providers to choose from to care for their families. St. Vincent's is an economic force in our community, and it provides a significant amount of benefit to the community through its outreach programs and services to help the underinsured and uninsured. As you know, Bridgeport is the largest city in the state of Connecticut, and its residents are among the most economically disadvantaged. We anticipate through the acquisition, Hartford HealthCare will bring resources to St. Vincent's and the Bridgeport community. On behalf of the mayor, he welcomes Hartford HealthCare to the City of Bridgeport and looks forward to working with its leadership to support the healthcare needs of Bridgeport residents. And he urges you to approve the acquisition. Thank you.
Thank you.
Good afternoon, Attorney Mitchell and the members of the Office of Health Strategy. My name is Dave Ingmanson. I'm a resident of Stratford, and I'm currently the Operations Manager for Supply Chain at St. Vincent's. I'm here today to offer my support for the hospital's transfer of ownership to Hartford HealthCare. I've worked at St. Vincent's for 35 years. For some, that seems like an extraordinary tenure, but there are so many staff members who have worked at St. Vincent's for 20 plus years. We all take pride in calling St. Vincent's my hospital. This feeling of pride and dedication has helped our organization weather many changes in healthcare, and we've survived and thrived with a dedicated team who does whatever it takes for our patients and for each other. Another example of our commitment is evident when it comes to our volunteering in many community events. There's never a shortage of employees volunteering on their personal time and lending a hand. Whether it's the St. Vincent's Sound Marathon to raise money for cancer patients in our community, for spending a day providing free medical exams at St. Vincent's annual medical mission at home. My coworkers are always there pitching in. One particular event is near and dear to my heart. I served as a first responder at Stratford EMS for 28 years, and I'm proud to volunteer annually for St. Vincent's Swim Across the Sound Sports Gala fundraiser. This raises money to help first responders, EMS, police, and fire, and their family members battling cancer. With such a large pool of St. Vincent's volunteers, I was truly honored to say that I was recognized as the Volunteer of the Year in 2007. As you can imagine, the talk among employees is focused on the potential of another big change becoming part of Hartford HealthCare. St. Vincent's leadership has kept us informed at quarterly town hall meetings, management meetings, and through articles in our employee newsletter. I can honestly say that my friends and colleagues are excited. There's renewed energy as we think about the investment they are making in us. It's exciting to think about expanding our reach and providing care to many more patients in Fairfield County. Being part of a larger health system within our own state will help physicians, nurses, and case managers connect patients with a network that has additional specialty services like home care, rehab, and senior services. From my work in the community, I know these services are needed and will be welcome. I'm excited about the future with St. Vincent's as part of Hartford HealthCare, and I, and many of the people I work with, hope you will approve this transaction. Thank you for your time today.
Thank you.
Good afternoon. My name is Tiffany Rodriguez, and I'm a Director of Performance Improvement at St. Vincent's Medical Center. I'm a proxy for Tom Giordano, who volunteers in multiple ways for the hospital. Tom had intended to be here today to offer his testimony for support of this affiliation, but due to a death in the family, he's unable to be here. Since Tom and I work closely on a capstone partnership between St. Vincent's and the University of New Haven, he asked me to read this testimony on his behalf. This testimony has also been submitted to your office. Good afternoon, Attorney Mitchell and members of the Office of Health Strategy. My name is Tom Giordano, and I have been a member of the Bridgeport community for over 45 years, many of those years in a key executive position within the medical imaging business. My connection points with St. Vincent's Medical Center are many, including friends and family members who have been patients here, volunteer member of the Patient Advisory Council for 6 years and past chairman, volunteer member of the St. Vincent's Quality and Patient Safety Committee, instructor for the capstone projects between the University of New Haven and St. Vincent's, and spearheaded that partnership. Major donor to the Medical Center Foundation for the last several years. This unique relationship that I have with St. Vincent's has allowed me to reach deep into the inner soul of St. Vincent's. And what I have found is an organization that, at its very foundation, has a genuine commitment to serve the patient, especially those in need and those that are vulnerable. Every single member of the staff truly embodies this mission. Many healthcare systems say that they do, but St. Vincent's doesn't. That is why I enjoy serving on the Patient Advisory Council, to make sure this obsession with the patient continues to grow. No hospital is an island these days, and as you know, historically, St. Vincent's has been a part of the Ascension Health System, whose member hospitals are mainly located in the Midwest. St. Vincent's and Ascension share a synergy as faith-based organizations. As the healthcare market in Connecticut has consolidated to grow and serve our market, St. Vincent's needs a partner who understands Connecticut, a partner who can share best practices, a partner who is investing in the future of the regional network. All the projects I have run between the University of New Haven and St. Vincent's have indicated this need over and over again. Ensuring St. Vincent's viability in a very competitive market where there are other choices means that it can continue to serve our residents and the region in the years to come. We have all experienced the value of having multiple players or systems in any market. Without choice, everyone loses, especially the customer, which in this case is we, the patient. This acquisition by Hartford HealthCare gives St. Vincent's the resources it needs to be successful in the Connecticut marketplace and continue to serve the community that depends on it for their healthcare needs. This acquisition is a win-win for everyone. Hartford HealthCare grows its network and expands access within the Fairfield County market. St. Vincent's joins a strong family of Connecticut-based hospitals committed to high-quality, patient-centered care. And best of all, St. Vincent's, at its very core, brings to us all a reminder that we in this healthcare market are here to serve every patient as if they are one of our family members, especially those that are most vulnerable. Thank you for your time.
Thank you. One last question. Is Chuck Ferlat here?
Not yet.
Not yet. Okay. All right. So we are going to take a quick 10-minute break, and then we'll come back and we'll go forward with our questions for the applicant. Thanks. All right, so we're back on the record, and at this time, the Health Systems Planning Unit is going to ask some questions of the applicants.
Okay, the first question relates to financials at St. Vincent's.
Introduce yourself. You got sworn, right?
I did.
Yes. Okay.
Good afternoon. I'm Chris Given. I'm CFO at St. Vincent's.
Good afternoon. Please provide us today with a brief overview of St. Vincent's current financial status, such that operating performance, financial stability, and also discuss projected financial status over the next couple of years with and without the proposal.
The current financial situation at St. Vincent's is stable. It's about a break-even recurring operating margin. We are seeing declining volumes for the last several years. We've implemented some strategic initiatives of late. Some strategic initiatives of late, in physician acquisitions, physician hires, investments in cardiology that are projected to improve the performance modestly, 1%, 1.2% volume growths over that time.
So how would St. Vincent's fare going forward with and without the proposal?
Without the proposal, we'd have to continue to rationalize services and make sure to keep the cost structure down if the volumes continue to decline. With the proposal, we have a greater opportunity to attract the best talent, collaborate with a locally focused system of care to generate efficiencies and best practice and maintain the high quality that we take our pride in.
Do you have an idea of what the operating margin or total margin was for FY 2018?
2018's recurring operating margin was $4.5 million.
Would you know as a percentage?
It's approximately 1%. I don't know off the top of my head.
And what generally is considered a healthy margin for hospitals?
I generally look at it in EBITDA, which would be about a 10% EBITDA would be our target, which would probably require, 3% operating margin.
Thank you very much. Okay, next question is in regard to accessibility and services. The first question itself relates to Ms. Rudolph's testimony on page 6. Go ahead and read it. Page 6 of the pre-filed testimony states that as the only extension hospital in Connecticut, St. Vincent's will be challenged to support the development of the required provider networks and care coordination capabilities necessary to meet fee-for-value payment models. Please explain what is required to create these provider networks and why St. Vincent's would be challenged to accomplish this on its own.
To create the provider networks that we need to sustain the comprehensive level of services for our community, we need to continue to invest in access sites for care. Healthcare is local and people need healthcare in their neighborhood. To be able to do that, it could be a brick and mortar investment such as acquisition of a facility, or it's an affiliation agreement. All of that takes an investment out of working capital, out of our operations.
And how will becoming part of the Hartford healthcare system alleviate those challenges for you?
The breadth and scope of Hartford HealthCare allows us to align our priorities, to invest in areas to develop the network that is in alignment with priorities for the patients here in Connecticut. We have access to already established investments and resources throughout their system of care, and that expansion capability tends to be less costly than a new startup or build-up.
And I guess in addition, Hartford's going to be investing $135 million
Yes.
to help improve a whole bunch of things, including ambulatory development.
Ambulatory development, and as well as the integration of the electronic medical record of Cerner, or excuse me, Epic from Cerner, which really moves us into clinical integration and being able to create a seamless patient record for as they travel through the continuity of the continuum of care and the networks that we want to continue to develop.
Okay, thank you very much.
Welcome.
Continuing along with services, page 24 of the pre-file response states that St. Vincent's has identified the need for additional capacity and that Hartford HealthCare is considering expanding the following service lines: orthopedic surgery, cardiovascular services, ambulatory surgery, robotic surgery, neurology and neurosurgery, oncology, and urology. Please describe how you determine the need to enhance and expand access to these specific services.
Great. Typically what we'll do is we'll start with Mike Daglio, President Fairfield Region for Hartford HealthCare. And typically what we'll do is we'll assess a provider needs assessment, and we'll run a study, and we do this at Hartford HealthCare across all the regions and not just Fairfield. We haven't conducted one yet, and we'll be in the process of doing one for the entire system. And at that point, we'll be able to identify from the population and the types of populations, the demographics of the populations, the types of specialists that would be required to meet the needs of a community, not just in the near term, but also in the longer term as they look at the age of the population and where the age demographic is moving. From there, we were able to assess the number of providers that are in the market today and what the projected number of providers would be needed in the future. From there, we can then do our gap analysis and prioritize where we see specialty needs for the communities as we go forward. We also look at the age of physicians and the retirement window of physicians as we go through this assessment as well. So it's not just the number of providers, but where are the providers that exist in the community today? Where are they in their careers, and do we need to also be planning for their retirement from the workforce as well?
Okay, so at this point, the study has not been completed, so there's not a study or other evidence that you can share with us today?
Correct.
And how soon would that study be completed?
So we've committed to our board within a year of the closing that we would have a strategic plan in place that would include the provider outlook for the region, as well as the specialty services and commitments.
Just another follow-up. Given other local hospitals and area providers, explain why the expansion of these particular services would not be duplicative in the service area.
Well, again, some of these providers will be providers that already exist in the service area, so it'll be our way of building a strategy in cooperation with these providers. So not every service will require Hartford HealthCare to bring their own providers into the marketplace. Our model of care and what we think the physicians in the community are so attracted to are our institute models that we have, where we really allow the physicians and provide the physicians the opportunity to lead the institutes across our system. So there are alignment models that range from employment to professional service agreements to income guarantees or other joint venture or alignment models we would have with physicians in the marketplace who are private practice. So in not all situations would we be coming forward with Hartford HealthCare specific providers, but those that we would align with in the community.
Okay, thank you. Could you provide us with a list of the priorities in order for service enhancement in the St. Vincent's primary service area?
I don't believe we provided
I don't think we were asked to,
in
but
order,
we
but
did discuss.
but we did talk about top 5 priorities. I mean, primary care specifically would be a priority. Behavioral health, for sure, is a priority for us based on not only our commitment to behavioral health services across Hartford HealthCare, but also based on the community health needs assessment in every region in Connecticut, the need for behavioral health. So that would be another priority for us. Care for the aging is another priority, as there's a demonstrated need that Fairfield County is an older community, and with greater needs that we think are being unmet currently, that we want to continue to expand. And again, expansion through the institute models to ensure that needs are being met of the community once we do the demographic study.
And the services would be a blend of sort of inpatient or outpatient?
Absolutely. I mean, there's, as Mr. Joseph articulated, 52% of what we're doing now is ambulatory, and 48% is inpatient across the Hartford healthcare system. We see probably a similar model in Fairfield County. Most of what we're thinking about in terms of expansion and investment is in the ambulatory space, but there also is there will be continued need for tertiary care. St. Vincent's is a tertiary hospital, so inpatient services will also be expanded in the services we provide in the hospital.
Okay. I think I heard you state earlier that there is not currently a physician recruitment plan, but you said something to the effect that there is a preliminary plan of some sort?
Well, preliminarily, we feel we have a feeling for the marketplace. We think we know. I mean, all of the specialties I just listed are a need everywhere. So we have a preliminary understanding of the marketplace, and we believe that will follow pretty much all the other regions we look at, and where we typically start with growing the access for services. And the greatest need is typically primary care, behavioral health services, and that's why I'm listing those as our priority.
And when will that physician recruitment plan be available?
Again, that'll be part of the strategic plan that we owe to our board within the first year post-closing. And again, it won't just be a study for Fairfield County. It's a study we do every couple of years for the entire system.
Okay, thank you very much.
Sure.
Good afternoon. The next set of questions that I have for you refer to the cost of care to the consumer. The application states that there are no plans to adjust price structures or impose new facility fees, and that the affiliation will not adversely affect patient health care costs. Please discuss and provide specific evidence to support your assertion that patient health care costs will not be adversely affected by the proposed affiliation.
First of all, good afternoon. My name is Charlie Johnson. I'm the CFO for Hartford HealthCare. In all of the evaluation that we did as to whether St. Vincent's was a good fit for Hartford HealthCare, technically St. Vincent's is a competitor today, and so we're precluded, by federal law from actually looking at their contracts. But we have agreed that whatever those agreements are, and for however long that they extend, that we will accept the agreements as they've currently been negotiated by St. Vincent's into the future. So we certainly have no plans, and our business modeling did not take into account any adjustment of pricing beyond what St. Vincent's had already negotiated on its own behalf, if that's clear.
So just this follow-up, so that's all existing contracts?
Yes.
Thank you.
How will you ensure that planned service expansions do not increase the cost of care for consumers or employers in the area?
We, again, we are hopeful that by the physician recruitment efforts that we have, as well as our ability to attract more business from physicians that are already in the market, that we'll be able to, in effect, cover the overhead costs of St. Vincent's more effectively by a broader revenue base. So if anything, it would be our hope over time that as we're covering those overhead costs, that the overall cost of care should in fact go down. Now that there's some speculation to that, but that is typically what we would expect to happen. So we are not forecasting or modeling an overall increase in the cost of care to the community.
And how will you ensure that the appropriate utilization of expanded service lines to avoid unnecessary cost growth while maintaining access to care?
we're very proud at Hartford HealthCare, and we believe we've been leaders in sort of squeezing out, if you will, unnecessary utilization. It's been widely reported in industry literature that hospitals gain, if you will, being under a fee-for-service model. In other words, the more you do, the more you get, the more you get, the better you do. We have deliberately taken steps as part of our business model to be responsible to the community, and we have been leaders, and will certainly do so at St. Vincent's in making sure that care is delivered appropriately in the right amount and at the appropriate venue. So, as an example, we will look at inpatient services, and if we feel those more properly belong in an outpatient environment, we will do that. And if something is in the outpatient environment and we believe it should be done in a clinic or a physician office, we will work in our model of care with our quality metrics to ensure that happens. And if that results in lower volume, so be it. That has been our practice at Hartford HealthCare now for several years. We've been doing this long before I think we were in effect required to by some of the incentives that CMS has placed upon hospitals recently.
Thank you.
Next one is going back to clear public need. Attorney Mitchell's original question. Mr. Joseph said that we should follow up with you for additional details. So maybe you could provide some additional details on how you feel that this proposal satisfies the criteria of clear public need, given the fact that St. Vincent's appears to be a relatively healthy system.
This is Jeff Lack speaking. I think the fact that it has 14,000 plus hospital patients that it takes care of today, that it provides indispensable care relative to behavioral health within its community and has a long-standing tradition of doing so, and the fact that it takes care of hundreds of thousands of patients in terms of globally from an outpatient and primary care standpoint, I think to me it's an indispensable provider in the greater Bridgeport area, and it's essential, to the region. So I do believe that it is essential to this region.
And you don't think that any of those healthcare needs could be met by other sort of systems in the area?
I think the care that St. Vincent's provides to the vulnerable, to the poor, as you heard, nearly 70% of its care is provided today to Medicaid or Medicare patients. With the volume that we're discussing, as well as issues around accessibility for that level of care, no, I don't believe that the existing regional health systems could easily absorb that level of care and responsibility.
Okay, thank you very much.
Thank you.
Just one follow-up question for anybody who can answer it. Is the physician recruitment plan synonymous with the medical, I think it's staff development plan?
Yes.
Okay. So that concludes our questions with regard to the transfer of ownership for St. Vincent's Medical Center. I'm going to ask for a few more members from the public to come up. I'm looking for Chuck Ferlot, Joan Massey, Tom Kraus. Not here? Okay, you can come on up. So when you give your comment, just make sure that you state your name, and I just want to remind everyone that they have, if you're a public official, you have 5 minutes. If you're a member of the public, you have 3 minutes, and don't be discouraged if we stop you. It's only because we want to be fair to the people before you that had to stop when their time was up. Are you ready?
Yes.
Okay.
Good afternoon, Attorney Mitchell and members
of the Office of Health Strategy staff. My name is Joan Massey. As a resident of Stratford and a longtime St. Vincent's patient, I wanted to participate in this public portion of the hearing. I've been a patient of Dr. Anya Wagner at St. Vincent's cardiologist for 6 years. It was her expertise and thorough care after suffering 2 heart attacks that ultimately led to my life-saving heart transplant. I continue to see Dr. Wagner regularly and have developed a close relationship with her entire staff at St. Vincent's, including the cardiac rehab team. I've quit smoking and have learned the importance of exercise for good health. Dr. Wagner and Sue Casso, registered nurse, have taken the time to get to know me as a person, not just a patient. Last year, they asked me to be St. Vincent's Women's Heart Champion, and I was honored to be considered. Women's Heart is a national organization that is educating, supporting, and advocating for women with heart disease. After I agreed to take on this role, St. Vincent sent me to their annual conference for training. I now lead a monthly support group, for women coping with heart disease, and I'm so happy to help them with their challenges. I am inspired by St. Vincent's dedication in helping heart patients, especially women. Women are in critical need of education about heart health and heart attack warning signs. These signs are very different for women than for men, and more women die each year from heart attacks. St. Vincent's has always shown me warmth and comfort and respect, and I'm proud to partner with them in this endeavor to help the Bridgeport community. I'm excited with joining another Connecticut health system that wants to expand services and bring new much-needed healthcare resources to Bridgeport. I encourage you to approve this acquisition, and thank you for your time.
Thank you.
Good afternoon. Attorney Mitchell and members of the Office of Health Strategy staff. My name is Tom Kraus, and I serve as the Chief Operating Officer of Southwest Community Health Center, a local federally qualified health center based in Bridgeport. And I thank you for allowing me to speak with you today about why I support the acquisition of St. Vincent's by Hartford HealthCare. For over 40 years, Southwest has enjoyed a collaborative partnership with St. Vincent's. Our patients are referred there, and our care coordination staff helps ensure a seamless continuity of care between St. Vincent's services and our primary care services. In 2018, St. Vincent's and Southwest deepened our collaboration when St. Vincent's transitioned the provision of primary care services from its family health center to Southwest, enabling St. Vincent's to enhance the provision of critical specialty care services for this uninsured and underserved patient population. This transition has reduced wait times in important specialty areas such as cardiology, orthopedics, neurology, and podiatry. The combination of our two organizations providing complementary services has ensured that the majority of the healthcare needs of the community are being addressed and that optimal patient access, follow-up, and care coordination are achieved. Our operations committee is composed of representatives from both organizations, and we meet regularly to focus on patient experience, quality, financial reporting, and operations. Our collaboration is providing more access to specialty care and is meeting our goals of reducing unnecessary or avoidable emergency department visits, hospitalizations, inpatient readmissions, and improving health outcomes. Our collaboration with St. Vincent's is based on the fact that in concert with our similar missions, Southwest also enjoys its role in providing clinical opportunities for the St. Vincent's internal medicine residents, to experience our urban population base of uninsured, underinsured, and homeless residents. As a partner in care with St. Vincent's, I view the acquisition as a critically important way to preserve access to the quality and compassionate care that St. Vincent's has been known for providing to our community. As a native of Bridgeport, and having worked and served in the community myself for almost 20 years, I can speak firsthand about the critical need to have St. Vincent's continue to be a vibrant and contributing member of our healthcare community. St. Vincent's and Southwest Community Health Center are founding members of the Primary Care Action Group, a collaboration of local hospitals, departments of public health, federally qualified health centers, health advocacy groups, and numerous community and non-profit organizations serving Greater Bridgeport.
Mr. Krause,
Yes.
if you wouldn't mind, can you summarize your last few paragraphs?
Certainly.
Thank you.
The ones I intend to read are the ones that I just read.
The ones that you have left. I'm sorry, I'm interrupting you.
Okay.
Your time is run out.
Naturally, we are very supportive of this endeavor because, as was mentioned previously, we serve similar populations. We rely on St. Vincent's for the continuity of care for our patients, and we look forward to increasing our participation with the Hartford HealthCare Corporation.
Thank you.
Thank you.
Hello. My name is Chuck Furlot, Attorney Mitchell and members of the Office of Health Strategy staff. Do you want me to go on speed dial or?
So you have 5 minutes.
Okay, it won't take me long. I'm president and CEO of Aquarium Company based in Bridgeport, and I'm a former member of the foundation board of St. Vincent's and the board of St. Vincent's, and I've been a member of the greater community here for a long time, 30 plus years, and I've been CEO of Aquarium for some 16 years. And my company has been in the water supply business since 1857, founded in Bridgeport 4 years before the Civil War began, and we are now a subsidiary of Eversource and a much larger utility, and so I've had the firsthand experience of being acquired recently by a larger regional entity. We've had a long and deep partnership with St. Vincent's for many years. Our partnership has included our involvement in the Swim Across the Sound and the St. Vincent's Special Needs Services. We've co-launched the House of Hope, a food drive to feed the hungry. And of course, I mentioned I was previously involved as a board member. So I'm very familiar with the culture, the values, the people. And during the time I served on the board, I can tell you that St. Vincent's was in a growth mode, and in many ways served as a model for other hospitals throughout the state and elsewhere, through its reputation for safety, its clinical services, and its financial success. But over time, I've watched hospital consolidations happen in the state, and it's become clear that St. Vincent's was really on an island owned by an out-of-state organization that really operated only one hospital in Connecticut. And so, as a business leader and as president of a company that recently has become integrated with a larger regional organization, I can see the benefits that St. Vincent's will achieve through its sale to Hartford HealthCare. Besides the obvious purchasing and supply chain and scale, what St. Vincent's needs is to be included in a Connecticut-based health network that understands the state in which it operates and an owner that will invest in its future growth and potential of its employees and community. So from everything I know about Hartford HealthCare and the network it's built so far, it is exactly what St. Vincent needs. I've also heard enough and know enough to know that there's a match between the two organizations in terms of culture and their values, and that's critically important. It's important to me personally. especially as a former board member and a member of the greater community. So, in summary, St. Vincent's has a special culture and has been known for the compassionate care that it delivers. So sustaining this organization, doing more than just sustaining it actually, investing in it, growing it is what our greater community needs. And it's good for patients, it's good for the economy, it's good for the employees who have served St. Vincent's with loyalty, most for many, many years. So, I urge you to approve the application for St. Vincent's to be acquired by Hartford HealthCare. I think it's great for St. V's, it's great for the state of Connecticut. I thank you for your time.
Thank you. All right, so we are going to go ahead and move on to docket number 1832272. But before we do that, I just want to turn back to you, Attorney Fusco. Anything else new or different that you wanted to tell us that we haven't heard with regard to 1832271?
No, I think we covered everything.
All
Thank
right,
you.
and then just for administrative purposes, anything that's that is a late file, is it okay if we do it at the end of the group practice?
Yes, we can do them all
Okay,
at the
because
end.
we already went ahead and took notice of both companion applications. So
Yes.
we'll go ahead and we will adjourn this one. We'll leave it open for comment until May 7, and then we will go ahead and move on to the next application. So with regard to 1832272, Attorney Fusco, do you need me to go over the instructions again, or would you like to waive that?
No, I'll waive that.
Okay. And would you like to make a presentation?
We would like to make a presentation, although in terms of the introduction, are we going to do the table of the record? Because there is one correction to the table of record that we discussed.
Yes. All right. All right, so I'll just make a brief announcement. So this public hearing before the Health Systems Planning Unit, identified by docket number 1832272 CON, is being held on April 30th of 2019 to consider Hartford HealthCare's application for transfer of ownership of St. Vincent's Multi-Specialty Group Incorporated to SVMC Holdings Incorporated. I take judicial notice of docket number 1832271 CON involving the transfer of ownership of St. Vincent's Medical Center to SVMC Holdings, an affiliate of Hartford HealthCare Corporation. The parties have waived the hearing instructions and other formalities for this proceeding. The hearing is being held again pursuant to Connecticut General Statutes 19A, 639A, and will be conducted as a contested case in accordance with the provisions of Chapter 54 of the Connecticut General Statutes. Again, my name is Michaela Mitchell. I have been designated by Victoria Veltri, the Executive Director of the Office of Health Strategy, to serve as the hearing officer in this matter. At this time, I'd like to reintroduce to you staff from the Health Systems Planning Unit who are here to assist me in gathering information regarding this application. To my left, to your right, is going to be Brian Carney, and then also on the other side is Ms. Jessica Rival. Mr. Carney, are there any additional exhibits to enter into the record?
Yes, in addition to A through M, we have Exhibit N, the agenda for today, and Exhibit O, table of record.
And then also, Attorney Fusco, you had a correction?
Yes, just for clarification, Exhibit M is a document that OHS had uploaded to the portal.
Yes.
It's listed as Hartford HealthCare's top 10 procedure services generating facility fees. That's actually a document that is specific to Hartford Hospital. The system uploads them for each of the system hospitals, and the one that you've uploaded is for Hartford Hospital specifically.
Okay, so duly noted. We'll go ahead and revise that and make the correction to this table of record, and then also to the final table of record. Any other objections?
No objections.
All right, so at this time, I'm going to go ahead and again swear in the individuals that are going to testify on behalf of the applicants.
Everyone should just stand again.
All right, just remember that when you come up, just state your name and adopt any written testimony that you have submitted prior to testifying. In addition, if you use any acronyms, just tell us what they mean. Attorney Fusco, we do have a representative here, Representative Kristen McCarthy. I believe it's Vahey. Do you mind if we allow her
That's
to go?
fine. Yep, she can speak first.
Okay.
She's the state rep. Sorry.
Good afternoon.
Hello.
Thanks for having me here today. My name is Kristen McCarthy Vahey. I'm the state representative in Fairfield, and I'm here today in full support as a Fairfield rep, but I'm also here on behalf of members of the Bridgeport delegation who need to be in Hartford on legislative business today. So on their behalf, I would like to read this letter into the record. So picture me as Representative Chris Rosario right now. Good afternoon, Attorney Mitchell and members of the Office of Health Strategy staff. My name is Chris Rosario, and I serve as State Representative of the 128th District and Deputy Speaker of the House. My colleagues and I represent the Bridgeport delegation, and together we want to voice our support of the acquisition of St. Vincent's by Hartford HealthCare. We believe the investment that Hartford HealthCare plans to make in St. Vincent's, and as a result in the greater Bridgeport region, will serve to further improve access by ensuring that St. Vincent's mission to serve everyone who needs access to health care, regardless of their ability to pay, is maintained and enhanced. In addition to its important role in healthcare, St. Vincent's is one of the largest employers in the city of Bridgeport, and I'll add my piece certainly to the region as well. This acquisition and the resulting growth from Hartford HealthCare's planned investment makes good economic sense, helping to secure and grow more jobs, training medical residents right here in Bridgeport to be the physicians of the future, and we hope stay here to practice, keeping St. Vincent strong so that it continues to be an economic engine in the region. As representatives of the community we serve, it is up to us to understand the needs of the people who live in Bridgeport and the greater Bridgeport region. Serving the state's largest city and poorest city that is also home to 2 hospitals makes us acutely aware of the vital role of healthcare providers in caring for people when they are sick and in helping to educate them on how to stay healthy. Outreach programs that teach people how to be healthier by reaching into the community are critical, and St. Vincent's is known for its collaborations and outreach programs, such as the House of Hope, collecting food for Bridgeport's food pantries each year, the Hope Dispensary, where hundreds of uninsured and underserved patients can get their prescriptions filled free of charge, and the annual medical mission at home that takes place in Bridgeport to provide free medical care to the homeless and uninsured. St. Vincent's has long been an important member of the greater Bridgeport community, serving its patients with compassion and employing thousands of caring people who live and raise families here. An acquisition by Hartford HealthCare with plans to invest in and to grow St. Vincent's enhances the programs and services it provides. It's the right thing to do for this community, for St. Vincent's employees, and the future of the city and its residents. We welcome Hartford HealthCare to the greater Bridgeport region and support the approval of this acquisition. And this is signed Chris Rosario, Jack Hennessy, Steve Sasstrom, and Dennis Bradley. And again, I would add that myself and the members of the Fairfield delegation, Senator Tony Long, Representative Laura Devlin, and Representative Brenda Kupchik all signed a letter in support of this Certificate of Need application. And so I do not have a letter to read from all of them into the record today. I'm here to tell you that not only these representatives, but all of us from the region are supportive as well. Thank you.
Thank you. All right. I'm going to turn back to you, Attorney Fusco, for your presentation.
Absolutely.
Good afternoon, Attorney Mitchell, members of the OHS staff. My name is Daniel Gottschall. I'm the Senior Vice President of St. Vincent's Medical Center, as well as the Chief Clinical Officer and President of St. Vincent's Medical Group, and a practicing physician on staff at St. Vincent's for 23 years. I adopt my pre-filed testimony. I would like to briefly introduce you to St. Vincent's Medical Group, its history, and its importance to the community. St. Vincent's Multi-Specialty Group has been in existence since 2009. It was originally created as an alignment vehicle for physicians. Our recruitment focus was on primary care and surgical subspecialties in order to meet the needs of the underinsured. We quickly grow over the last decade to care for over 30,000 patients a month with over 250 providers in 19 different specialties and 40 locations across the community that we serve. St. Vincent's Medical Group aims to increase access to services and improve care coordination for patients, developing standard care protocols, best practices, decreasing clinical variation across our continuum, and elevating quality and service standards in alignment with St. Vincent's mission, vision, and values. We are very pleased to be moving forward with a transaction that will see our group integrated into Hartford HealthCare Medical Group. Being part of Hartford HealthCare system will enable us to build upon our history, the cornerstones that we've put in place, providing high-quality care and patient-centered services. It will further grow our ambulatory network and assist us in recruiting top medical talent and executing on our population health management goals and vision of value-based care for our community. On behalf of our St. Vincent's Medical Specialty Group and our entire medical staff at St. Vincent's, we ask you to approve this transaction so that we can begin the next chapter of practice in collaboration with Hartford HealthCare. There are synergies and benefits to be achieved for our organizations, for our providers, for our patients, and Mr. DiBattista will address these in his remarks. Thank you for your time.
Good afternoon, Attorney Mitchell and members of the OHS staff. My name is Vincent DiBattista, and I am Senior Vice President for Physician Services for the Hartford HealthCare and also President of the Hartford HealthCare Medical Group. I adopt my pre-filed testimony. Hartford HealthCare Medical Group is the multi-specialty group practice affiliated with Hartford HealthCare. We have approximately 600 providers, including physicians and advanced practitioners, with locations across Connecticut and Rhode Island. We offer primary care, urgent care, and specialty services in over 30 different fields. Through our approximately a third of our total providers are primary care practitioners, including in over 40 sites, including our 18 urgent care centers. Like other Hartford HealthCare system providers, we are dedicated to providing patients with a personalized, coordinated care experience and a single high standard of clinical excellence. Our medical group that is physician-led is built around patient access, quality outcomes, and the offering of a superior patient experience. The integration of St. Vincent's Multi-Specialty Group will involve transporting culture and bringing the group into the Hartford HealthCare operating model that you heard before from Mr. Flax. As a result, both immediate and long-term benefits will be achieved. Immediately post-closing, we will begin converting St. Vincent's Multi-Specialty Group locations to our Epic electronic healthcare platform. This conversion will greatly enhance the group's ability to manage care and improve quality and convenience for patients. It will result in better care of chronic disease patients and allow for all patients the ability to communicate directly with their providers. Centralized access will also ensure that patients are seen in the most appropriate and convenient care settings. While the Epic conversion is underway, St. Vincent's Multi-Specialty Group providers and patients will enjoy the full benefit of the clinical, operational, and administrative resources of Hartford HealthCare. Together, we will begin to develop for physician recruitment and service enhancements in Fairfield County and an immediate focus on expanding primary care access. St. Vincent's Multi-Specialty Group providers will also participate in the medical group's physician-led councils, including population health, quality and safety, and Epic optimization. They will be part of the system's institute model including oncology, heart and vascular, neurosciences, urology, orthopedics, and behavioral health network. St. Vincent's multi-specialty group sites will also be incorporated into our patient-centered Medical Home Plus arrangement for Medicaid patients and our Medicare Shared Savings Plan accountable care organization. On behalf of Hartford HealthCare Medical Group, we ask you to approve this transaction so that residents of Fairfield County can benefit from the enhancement to access and quality that will result from the integration of the multi-specialty group into our system of care. Thank you for your time.
That concludes our presentation in this hearing.
Okay. So we'll start with our questions.
Okay, next question relates to population health initiatives, and it can be found on page 17 of the issues for the second document here. So page 17 of your pre-filed response states that the proposal will allow an opportunity to extend integrated care partners, ICPs, work into Fairfield County to support engaged providers who are committed to advancing population health initiatives and to overall health status in the area. Can you please first describe the scope of ICP's work?
Introduce yourself.
Is that on? Dr. James Carden. I'm Executive Vice President for Clinical Integration for Hartford HealthCare and Physician Lead of Integrated Care Partners, our clinical integration organization. Our model of addressing population health needs really starts with our care model, and that is care managers, which are both registered nurses and social work that are embedded in our primary care offices, both in our employed and our community primary care practices. They're responsible for two predominant work. One is transitions of care as patients transition from acute to post-acute, as well as post-acute to home. Their job is to make sure those transitions happen smoothly, and again, fill in the gaps that often occur when people are moving from place to place. The second component is chronic care management. This is folks with multiple chronic conditions, often that are most challenging to try and ensure they are getting the connected care they need. And they are, again, working through their primary care practices to develop care plans, ensure that those plans are being followed, and with continuous outreach. All of that work is done on an Epic platform called Healthy Planet. This allows us to bring in the patients, risk stratify them to, and then prioritize the work and the outreach that happens through our care management teams. That model is further enhanced by behavioral health embedded in our primary care offices. As Mr. Joseph outlined before, we are currently in about 19 of our primary care practices. That will continue to expand out. That is a warm handoff for patients who have comorbidities with behavioral health override that we are able to transition to behavioral health specialists at the time of their visits. Our success in terms of them accessing that care, traditionally referrals will lead to 20 to 30% of people actually following up. We're closer to 80 to 90% of folks who keep those visits. They're seen for 3 or 4 visits, and if they need ongoing therapy, we then transition them to chronic behavioral health therapy. We've seen dramatic improvements in terms of utilization and avoiding utilization in that. So that is the essence of the model. Again, it was built on Epic platform and then supported by alternative payment models that help incentivize providers to deliver high quality and control utilization.
Does that care management also include help with like pharmaceuticals?
Yeah, we have 2 pharmacists in a partnership with the UConn School of Pharmacy. We also educate their pharmacy PharmDs that come and that participate. They do 2 components of work. One, help develop treatment plans and otherwise to direct appropriate pharmacy management. They're also available to do consultation for complex pharmacy management to help clinicians as they work through that challenge. So they're embedded in the care teams as well. They will often do all the visits as well with patients who have significant challenges.
So when you talk about expanding into Fairfield County, so will the full scope of your services be implemented all at once, or will it be phased in?
We have not done that assessment. Obviously, a lot of good work is happening at St. Vincent's through their model as well. We need to understand that better, understand where their strengths are and how we can learn from each other as we look at. But the intent is to meet the same goals and objectives that we put forward, which are aligned between the two institutions.
And what kind of time frame are we looking at for this extension?
Starts when we can finally close on this, and then we'll start the planning and move forward. We've been able to roll out the model relatively quickly as groups have joined us. We have 2,000 providers now within the organization, and we would expect over the first year to clearly be able to meet those obligations.
And it's kind of like the groups would have to be a voluntary type thing to participate?
Two components. If you are going to participate in ICP, there's an expectation that this will be part of your participation, so that primary care providers don't get to say whether they will or want. If they want to be part of ICP, our ability to work with care management and participate in the program is essential for your participation in that. We've never had any much resistance, though.
All right, thank you very much.
So I have some questions about cost to consumer, and these are specifically related to facility fees. So, Attorney Fusco, I just want to turn your attention to Exhibit K for your witness.
And which document was that? Let me go back to the record here.
And that's just that it shows the estimate of statewide hospital facility fees.
It's the aggregate document. This one?
Yep.
So the question is this. Exhibit K shows an estimate of the net revenue of facility fees received by each hospital in fiscal years 2015, 16, and 17. Data in the document indicates that facility fees have increased for all Hartford HealthCare affiliated hospitals, some modestly, with the exception of, I believe it's Mid-State Medical Center. Notably, fees increased dramatically at Windham Hospital since 2015, while the number of visits remained consistent. Can you tell me what contributed to the significant increase in facility fees at Windham Hospital between 2015 and 2017?
Hello, I'm Charlie Johnson. I'm the CFO for Hartford HealthCare. I believe that, to the best of my knowledge, we have not fundamentally changed at Windham Hospital the way that we charge for facility fees. I believe there was a definitional change at the hospital that allowed us to, in effect, capture the information more properly, and I believe that the most recent data is therefore correct. I do not believe we've increased facility fees at Windham Hospital.
When you say capture information more properly, was this maybe an administrative or calculation error in the way that the fees were calculated?
Underreported.
We believe it was administrative, yes.
Just turning your attention to Exhibit L, is anyone able to identify the top 10 procedures and services that generate facility fees for, and I believe it is for St. Vincent's?
This is the section. So you're referring to the one that just lists facility visit established?
Exactly, yes.
they're different physician level visits. Mr. Givens doesn't know the specifics as between the levels, but that's information we can get you. Levels 1, 2, 3, 4, 5.
Okay. And just for the purpose of the hearing record, I believe this has probably been given to us in writing. We just want to make sure or ask you to confirm that no new or additional facility fees will be added as a result of acquisition of the group practices or planned service enhancements.
Just want to state that Hartford HealthCare does, in some of its hospitals, maintains physician practices that are considered hospital outpatient departments and bill facility fees. It's not our intent to change the direction of St. Vincent's Multi-Specialty Group, which does not bill under a facility fee hospital arrangement at this point, nor does the practices that are in Hartford HealthCare Medical Group.
Okay, I think that concludes our questions. Let me just... Okay, that concludes our questions. Is there anything else that you wanted to add, Attorney Fusco?
No, we're all set. Thank you.
All right, so we are going to move on to just a few more public comments, and then at the end we'll go over some of the late files.
Okay.
Let's do it. So for people who are sitting out, I don't want to call it an audience, but for people who are sitting, Ms. Greer, who works in our office, is approaching the podium. She's going to call you in the order in which you're going to speak. For members of the public, we're going to limit you to 3 minutes. For anybody who's a public official who's come in and we're not aware of it, we will give you 5 minutes. Just let us know who you are when you come up. We're going to go ahead and do all 5 people who are left.
I'd like to call Julie Norco, Shanice Nicholas, Kate Hamford Donahue, Dr. George Goldfarb, and I'm not sure if Dr. Peter Solano has arrived yet.
Good afternoon, Attorney Mitchell and the staff of the Office of Health Strategy. My name is Julie Norco. I'm a lifelong resident of Stratford, except for a brief period when I thought I might stay at Carolina Tardio, and I also have had a lifelong connection with St. Vincent's. It has been my family's hospital of choice for 2 generations. My mother and aunt attended nursing school at St. Vincent's College. 45 years later, St. Vincent's doctors discovered and treated my mother's cancer. My sister decided on a second career with nursing after watching oncology nurses on the 8th floor of St. V's treat my mother, and she graduated 2 years ago from St. Vincent's College. I am also in HealthCare. For the last 8 years, I have been an employee of HHC, and my current position is Regional Director of Assisted Living Operations for the Senior Services Division. When I think about St. Vincent's becoming part of HHC, I reflect on my experience with employees of these organizations, like the oncology nurse at St. V's who made it a point to spend extra time with my mother when she was feeling particularly uncomfortable, even though my mother would never admit that she was uncomfortable. I think about the St. Vincent's doctor who made an after-hours call to my husband to share test results rather than have him wait overnight. The driver at Hartford HealthCare's Adult Day Center whose kindness eases the anxiety of a client with dementia. And the HHC social worker who works extra hours each week to help vulnerable residents transition into our assisted living community. These individuals and so many others in these two organizations all share the same desire to provide patient-centered care and to treat patients with dignity and respect. As a patient, I trust St. V's, and I felt cared for. At times, this has meant transparency, admitting when an experience was flawed, and accountability in finding a way to fix it. I believe these are qualities also embodied by HHC and essential in this new era of healthcare. In summary, I'm excited about the possibilities for expanding access to care for Fairfield County residents who need support through home and community-based services, especially after they leave the hospital. Currently, St. Vincent's does not have the post-acute part of the healthcare continuum. In particular, I look forward to seeing how HHC's expansion in Fairfield County will benefit patients like my mom, seniors in my neighborhood and church, and other vulnerable individuals needing these services. Thank you.
Thank you.
Good afternoon, Attorney Mitchell and members of the Office of Health Strategy staff. My name is Shanice Nicholas. I am a registered nurse and Senior Director of Clinical Operations for Surgical Services at St. Vincent's. I've worked at St. Vincent's for almost 15 years, and I'm a resident also of the Bridgeport community. I'm here today to offer my support of our hospital's transfer of ownership to Hartford. During my career at St. Vincent's, I've experienced many changes that have occurred over the years as healthcare continues to transform. What has not changed, however, is the integrity of the caregivers at St. Vincent's and our organization's commitment to our values. First and foremost, it's providing compassionate care to our community. I have the honor and privilege to represent my nursing colleagues at St. Vincent's and hopefully convey our optimism about our future with Hartford. This optimism is shared with all of our disciplines across our organization. We learned about Hartford HealthCare during our recent town hall meetings that were held for all employees. It was easy to see the commonalities between our organizations. I believe they understand us. I believe they understand and appreciate our history, our vision, and our mission as a Catholic healthcare organization. It's also exciting to know that they will be investing in us, capital and resources, into St. Vincent's, enabling us to expand our services in Fairfield County. We have an aging population in this community, so access is essential to primary and specialty care, as well as senior services. Hartford has a reputation for excellence and quality in their approach to coordinated care. Their institute model enables the sharing of best practices and resources. I am confident we will learn a great deal from them. They can also learn a significant amount from us on our approach to care. The synergy between our organizations with aligned mutual values will translate to higher quality. We recognize that being a part of a larger health system within our state will allow us as healthcare providers to better manage treatment and connect patients to services within our own network. This network will provide additional services such as visiting nurse, home care, rehab, and senior programs. I am so excited for St. Vincent's and the beginning of a new chapter with Hartford, and hope you will approve the transaction. Thank you so much for your time.
Thank you.
Good afternoon. I've got a little bit of laryngitis. Maybe there's a doctor in the house. Oh, maybe. Anyway, good afternoon, Attorney Mitchell, members of the Office of Health Service Strategy staff. My name is Kate Hanford Donahue, and I'm the President and CEO of Hanford Research, a custom chemical manufacturing company headquartered in Stratford. I also serve as the chair of the Bridgeport Regional Business Council, representing more than 700 member companies throughout the greater Bridgeport community and the Bridgeport, Stratford, and Trumbull Chambers of Commerce. I'm also, 3 generations of my family have been patients at St. Vincent's. I'm here today to offer my support the CON, application for transfer of ownership from St. Vincent's to Hartford HealthCare. As a business owner and a healthcare consumer in Connecticut, it's important to me to have strong hospitals in the community for my family and my company employees who live and work. As we know that hospitals are among the largest employers in our greater Bridgeport area and provide an economic as well as community benefit to the region. I've also seen the consolidation that's taken place over the years as smaller independent hospitals have become members of large health systems. I can see the benefits for the hospitals, more efficient purchasing, use of resources across a larger scale, and the ability to build a more comprehensive network of services for patients. I can also see how these larger systems can benefit the local communities by increasing access to more physicians, enhancing technology, and adding more services. That's why I support this acquisition by Hartford HealthCare. It makes sense for our community and for the employees at St. Vincent's, and it ensures that we continue to have strong, vital hospitals in the greater Bridgeport community to serve patients and their families. I've been impressed by what I've heard about how Hartford HealthCare is organized and the network it's formed. I anticipate that St. Vincent's will be able to continue to provide the type of care my family and the families of those that work at my company have grown to depend on. I also anticipate that St. Vincent's can grow with the type of resources that a large system like Hartford can bring to this community. As a business owner, I appreciate that choice and competition are good things. They keep my company sharp and focused on consistently performing to meet the needs of our customers. The needs of healthcare customers, consumers in our area should be top priority, and ensuring that healthcare providers are focused on the highest quality and best value can be achieved when we have a healthy degree of competition among our healthcare providers, and patients have a choice for their care. This acquisition will position St. Vincent's within a local Connecticut system that can provide it with the resources necessary to remain viable and successful in an increasingly challenging market. A recent report by the Connecticut Hospital Association describes St. Vincent's as an economic cornerstone of our community, fostering economic growth across the state. It noted that in 2017, St. Vincent's and its subsidiaries had a direct economic impact on the community of more than $991 million. Their expenditures for salaries, goods, and services, as well as facility construction, ripples out into our community and drives growth in many business sectors. We need a strong St. Vincent's. As a business owner and a representative for the many businesses who support and are supported by St. Vincent's, I urge you to approve this acquisition. Thank you.
Thank you.
Good afternoon, Attorney Mitchell, members of the Office of Health Strategy. My name is Dr. George Goldfarb. I'm a primary care physician with a private practice in the community. I'm here today to offer my support of the Certificate of Need application for transfer of ownership of St. Vincent's Medical Center to Hartford HealthCare. My practice, Drs. Goldfarb, Rano, and Associates, has been a proud partner with St. Vincent's for many years, and I practiced in the community for 30 years, as well as trained at St. Vincent's. I'm a former board member, former president of the medical staff, and round daily on patients at St. Vincent's Medical Center. We're living in a period of great change in the healthcare industry. Some good, most not good. One potential great change is St. Vincent's becoming part of a well-respected local network called Hartford HealthCare. In healthcare, the only thing that really matters is caring for our patients in the community. Having a local involved parent company will make more responsive, cohesive, and make it a more responsive, cohesive environment for our patients to get the care they need without having to leave their community and having the family support right here. In the past 34 years working with St. Vincent's, one thing that hasn't changed has been their commitment to excellent patient care and care that is focused on quality and compassion for everyone in our community. I've also seen the outreach St. Vincent's provides to the underserved in many different and creative ways. I look forward to the annual medical mission, which brings together all members of the St. Vincent's family, from dietary to office staff to private practice physicians, with one goal: to help the most underserved and forgotten people in our community. At these one-day missions, many of our community docs, along with our residents and the multi-specialty group physicians, volunteer our time to treat patients who are homeless and uninsured. We give them medical exams as well as prescribed medications and help them with setting up follow-up care. They also get to pick up new coats, shoes, glasses, get flu shots, and have a good meal, all provided by the St. Vincent staff, who's also volunteering their time. I do it every year because it's important for me to be part of the community, and I do it because St. Vincent's has always been the place to go where everyone was treated equally without concern for any payer source. From the day I walked into St. Vincent's Medical Center in 1985 as a young intern, dealing with the Daughters of Charity has always been a pleasure. I've been made to feel comfortable and part of a family, and everybody is treated with respect and dignity. I believe that St. Vincent's will grow under the umbrella of Hartford HealthCare and be an even better place for patients to come and physicians to practice. Being part of a larger health system within our own state of Connecticut will help physicians like me connect with patients with a network that has additional specialty care with the newest modalities to care for my patients, as well as home care, rehab, and senior services. St. Vincent's needs a local owner that understands and appreciates its history, its culture, and will invest in its future. And from what I know about Hartford HealthCare and the success it has had, the future of St. Vincent's could not be brighter. I'm excited about this new future for St. Vincent's, its employees, and our community, as well as the physicians of this community. And I urge you to approve the acquisition of St. Vincent's by Hartford HealthCare. Thank you very much.
Thank you.
Good afternoon, Attorney Mitchell and the members of the Office of Health Strategy. My name is Dr. Peter Semino, and I'm a primary care physician in Fairfield, Connecticut. I'm also serve as Vice President of the medical staff at St. Vincent's Medical Center. Thank you for this opportunity to speak in support of the Certificate of Need for transfer of ownership of St. Vincent's to Hartford HealthCare. As a physician and owner of Fairfield Medical Group, an independent medical group, I view this acquisition of St. Vincent's as a critical need to preserve access to quality and compassionate care that St. Vincent's Medical Center has been providing for more than 115 years. Their mission of high-quality, compassionate health care has impacted generations of families in Bridgeport and the surrounding communities. St. Vincent's has trained generations of physicians, including myself, nurses, and other healthcare providers throughout the decades through its clinical affiliations and residency programs. As a private physician who is active both at Bridgeport Hospital and St. Vincent's Medical Center, I appreciate the choices and options my patients have for medical care in the greater Bridgeport area. This will only be enhanced by allowing another major system to operate within this market. I have worked as a physician in the greater Bridgeport community for more than 20 years. I understand the challenges faced by St. Vincent's as the healthcare landscape has begun to consolidate over the last decade. This acquisition will enable St. Vincent's to become part of a large regional health center or system that operates within the state. We are all aware of the challenges facing hospitals and healthcare systems as they work to lower costs, increase quality, and provide high level of satisfaction both for patients and providers. With this acquisition, St. Vincent's and Hartford HealthCare will be able to work together to create innovative solutions to these challenges by enhancing population health capabilities and offering more integrated and seamless care, providing this community with the most advanced technology and experienced medical staff. St. Vincent's Medical Center Medical Center staff is optimistic about the future direction of St. Vincent's within the new Hartford HealthCare model. We have heard about Hartford's HealthCare's approach to comprehensive and coordinated care that promises to patients with an expanded ambulatory network, including primary care, urgent care, specialty care, behavioral health services, home health care, and senior services. The medical staff is optimistic and excited to be part of this new future. The expansion of this network will serve to increase access to primary and specialty care in the community we serve, as well as enhance the choices patients have in choosing where they seek to have their care. On behalf of the staff of St. Vincent's Medical Center, we urge you to approve Hartford HealthCare's request for permission to acquire St. Vincent's and its affiliates. Thank you so much for your time today.
Thank you, Dr. Smith. Thanks. Is there any more public comment? Okay, so we will take, let's take a 15-minute break just so we can get our requests for late files together.
Okay. We would also like to, Mr. Flax would like to give a brief closing remark if we can. I don't know if you want to do that after late files. Is that the best time?
Sure, actually we can do it before.
Okay. Do you want to
Yeah.
still take your break now, or should we do that?
Yeah, we'll take the break.
Okay.
And then we'll come back and let him speak.
Thank you.
All right. So Attorney Fusco, did you want to do the closing before we do the late files?
Sure.
Okay.
Turn it over to Mr. Flax.
Thank you. This is Jeff Flax, and thank you for the opportunity to provide closing remarks. I'd like to begin by thanking you, Attorney Mitchell, members of the Office of Healthcare Strategy staff, for allowing us this opportunity to present our proposal, for the time and effort that has gone into your review, and for the submissions and for the preparation involving this public hearing. I'd like to reiterate that I believe that St. Vincent's is an essential provider in Bridgeport and the surrounding areas, and I do feel strongly that Hartford HealthCare is the most capable and well-positioned organization to sustain and strengthen St. Vincent's as an indispensable community institution. The sale of St. Vincent's to Hartford HealthCare, a locally focused, clinically integrated system of care, will serve the public interest by first strengthening the ability to recruit physicians, secondly, by providing patients with meaningful choice, third, by enhancing the service quality, and finally, by advancing population health management initiatives and providing value-based care models. So we thank you again for your time and the opportunity to provide closing remarks.
You're welcome.
Thank you. That concludes our presentation. Thank you.
Okay, you're welcome. So with regard to late files, for the late files, I'm actually going to issue an order tomorrow so that you have everything that you need in terms of what we're looking for. So just to kind of go over it, we're looking for a list of expiration dates for payer contracts for SVMG. I think that we have them for the medical center. We were looking for them for SVMG, the group practice. Baseline cost information, both for St. V's and Hartford HealthCare System hospitals, and we'll be specific about that in the order. We are going to leave the record open for the cost to market impact review, and that would be the final version, but I do want to state that we are cognizant about time constraints, and so we are not going to delay the decision. We will try to have it as ready as possible once we receive that to go. Okay. And also with regard to both this application and the companion application for the medical center, I want to take administrative notice of the all payer claims database, which we have in our office. And that includes statewide claims data. And we will use that to verify the cost information provided to us by the applicants, and then also to take a look at the cost to market impact review as well. So with regard to the expiration dates and the cost information or the cost data, I'm kind of hesitant to set a deadline because I'm not exactly sure how long it's going to actually take you to comply.
Yeah, I mean, I would think we would need more details on exactly what you're going to be requesting with respect to cost, but what do you think?
Yeah, definition of the baseline cost that you're looking for.
Right.
Sorry, Dave Whitehead, Executive Vice President, Chief Strategy and Transformation Officer.
Yes.
I think to your question on setting a deadline for that, we'd like to see from your order the definition of what the baseline cost would be.
Okay. So what I will do is I will draft the order. I think what we'll do, because we're leaving the record open for the cost and market impact review, is we will set a date out, maybe like 3 or 4 weeks, and if you can get something to us earlier based upon what we send you, you can do that, and if you need an extension of time, you can also request that too. Is that fair?
It's going to be open anyway. Yes, that's fair.
Okay. Anything else new?
And you had mentioned before, will there be a deadline for submission of additional public comments? You had mentioned several times leaving the record open until May 7th, correct?
Right, for public comment. However, because the record will be open, if anybody submits anything, we'll still include it, but we would like to get all of the public comment in the record by May 7th, so at least we can start working on what we have.
Okay.
Anything additional?
Nope.
All right, so we are going to go ahead and adjourn the hearing. We're going to leave the record open for the order, CMIR, and then also for public comment up until May 7. And then we are actually going to stay here until 6 o'clock in case anybody comes in and maybe has public comment, but
Okay.
otherwise we're all done.
Okay, thank you.
Thanks.
Appreciate it.